all of us until we're in a daze and they can pass some crazy reform without us even realizing it. But for me, reducing health care costs and individuals pay more, not a good correlation. Let's go to another one of our Facebook fans, Zach, who tells us, I think this whole thing is stupid. I like the idea of socialized health care, but I think forcing Americans to get it is stupid. I'm not really sure how you could have socialized health care and not force everyone to have it, but all right. And our last one from Alex, who says, I agree with the White House. The report is totally inaccurate and self-serving. Insurance plans to many American people will be great, and it depends on government to reduce the costs, of course, but it's wrong that individuals pay $1,500 more. I would like to see included public option and a better medical assistance. Why such a long wait in search of a health care reform? American citizens need a quick solution. Well, Alex, as you know, nothing is quick when it comes to Congress. I guess I would ask the members of our panel today and our blogger bunch, aren't Americans already, essentially, I mean, we're hearing complaints from some of our Facebook fans, aren't they already seeing their premiums go up and the services go down just through the costs of all of this to American companies? I mean, isn't that just the trend no matter what happens in Congress?
Do you want to pick up on that, David? Because you were just in the middle of a thought there.
Yeah, no, exactly right. Costs are continuing to rise at a rate of about 7 to 8% a year. That's simply unsustainable. One of the things that healthcare reform will do is begin to bring down costs by changing the way we pay doctors. Right now we pay doctors for the volume of services they provide, and what we should be paying for them is in the quality they provide. We know that the best quality care in this country can actually cost less. Mayo Clinic, on average, costs about 17% less than its competitors. So we know high quality can cost less if we pay for it, and that's one of the tricks that's behind the debate that you don't hear a lot about, but it's really important going forward as this bill is implemented.
David, it's very interesting when talking about cost. There's a lot of confusion. I mean, let's use the Baucus plan as an example. The Congressional Budget Office saying that it'll reduce the deficit over the next 10 years by $80 billion or so. Then we have this report out today saying that it will increase costs to the individual over the next 10 years. John, let's have a look at some of the details of this plan, and we can discuss what you think about it. It's going to cost $829 billion over 10 years. It's going to serve about 94% of the non-elderly population. No public option, rather healthcare cooperatives. As we said, it does have this individual mandate, but not an employer mandate. And it will, as you all mentioned, require insurers not to deny coverage based on pre-existing conditions. So do you think, John, that Senator Baucus will get the 12 votes he needs to get this through the Senate Finance Committee?
Yeah, I mean, you can never be sure until the actual votes are cast. Certainly, the word around town is that they'll get all the Democrats and possibly Republican Olympia Snowe. Talking about the details, I think there's one really important distinction to make. I want to go back to that first number you read. It's the number we often hear, that it's $800+ billion bill. That just to be clear about what that number is, that is the money going out. That's the money the government will be spending as part of this program. But keep in mind, there's also money coming in. There's money coming in because we're going to be